In the movie Shutter Island, Teddy Daniels is the main character. Teddy is a strange case. You would think he's a normal person in real life because he presents himself as an intelligent, high-functioning person. So much that his traumatic experience during World War II is just a dent in the whole story, rather than overwhelming, which is his coping source.
Brendan, we took their guns, we lined them up. It wasn't warfare, it was murder.
One Saturday, Teddy arrived home from a work trip to his 3 drowned kids and a creepy wife. He asks where the kids are, and she says that they're in school. He says it's Saturday, and she smiles and says that they're in her school, and he looks towards the lake. Horrified, Teddy runs down to the lake and sees his 3 children face down in the lake. Although such an experience would seem to develop a post-traumatic stress disorder, his symptoms of PSD go from flashbacks to hallucinations to delusions and headaches. Somewhere along the movie, his symptoms turned from post-traumatic stress to a delusional disorder.
Oh my God, no! Come on, come on! No, please, God. Please, God, no! 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 No!
They meet Mr. Codley, who explains a bit about the facility and the psychiatrist. Dr. Codley says that there's a war going on between the psychiatrists, where a group of them believe that surgical techniques like lobotomies to treat patients, and the other side believes that psychotropic drugs are the way to treat people. He believes that sometimes just listening to the patients and quietly making their life comfortable is the way to go.
What?
Those paintings are quite accurate. Used to be the kind of patients we deal with here were shackled and left in their own filth. They were beaten, as if whipping them bloody would drive the psychosis out. We drove screws into their brains, we'd submerge them in icy water until they lost consciousness or even drowned.
And now?
We treat them, try to heal, try to cure. And if that fails, at least we provide them with a measure of comfort in their lives, calm.
Teddy loses his partner Chuck. While looking for Chuck, he climbs into a cave and sees a woman and says that her name's Rachel. They start talking, and she says that she used to be a doctor at the hospital, and they came up with a story saying that she killed her kids. Sounds familiar, right? It's the same story that his wife killed his kids. She says that there's a secret government program to test a number of new drugs on patients. Then she warns Teddy that they will not leave him alone. They will come up with some story that he went crazy. She asks him if he's had any serious traumas in his life and that they will use that to say that he started to crack.
They can't let you leave. I am a federal marshal. They can't stop me. I was an esteemed psychiatrist from a respected family. Didn't matter. Let me ask you, any past traumas in your life? Yes. Why would that matter? Because they're gonna point to some event in your past and say it's the reason you lost your sanity. So that when they commit you here, your friends and colleagues will say, of course he cracked. Who wouldn't after what he'd been through? They can say that about anyone. Anyone at all. The point is they're gonna say it about you.
This is the part of the movie where everything comes together. The doctor tells Teddy that he came to this island alone and that there was no partner. He sees his wife in a delusion that tells him that he needs to leave the island and not to go to the lighthouse, and that the lighthouse will destroy him. The doctor tells Teddy that he's a patient at the hospital and he has been for 2 years. He doesn't believe him. Dr. Codley tells him that he's been one of the most dangerous patients and that there had to be some people who wanted to do a lobotomy on him to manage him. The doors open, and Chuck, the psychiatrist who agreed to play along with Teddy's fantasy, tells him that his real name is Ladis. They show him on a chalkboard how he mixed up all the letters of a name to rearrange them to spell his full name.
Why did you make them up?
Because I can't take knowing that Dolores killed our children. I killed them because I didn't get her help. I killed them.
Here's my fear, Andrew. We broke through once before, 9 months ago, and then you regressed.
I don't remember that.
I know. You reset, Andrew. Like a tape playing over and over on an endless loop.
I think that this movie does a good job of showing the examples of how a person can seem completely normal on the outside, but is really going through a lot of things. At the end of the movie, where everything is put together, everything really makes sense, where you see the symptoms that he had that come into play, like the flashbacks of him and his wife, and the hallucinations that he saw his wife and that she was telling him to leave because it would be the end of him. Also, the headaches make a lot of sense too. I don't know if I would say that it does a good job of showing the treatments because there really were no treatments. They just let him come to his senses, which I guess would be the point that was argued, that the psychiatrist would just listen to the patient and make their lives comfortable, where the other groups of psychiatrists just believed in surgical techniques and lobotomies.